U.S.A.'s Director of Public Health, Seattle, King County. I want to thank everyone coming today and joining us as we share an important update on coronavirus here in King County. I'm joined today by Dr. Jeff Duchin, who is our Health Officer for Public Health Seattle, King County, Dr. Kathy Lofi, who's the Washington State Health Officer, Dr. Frank Rito, who is the Medical Director of Infection Control at Evergreen Health Hospital, Dr. David Knopfler from Overlake Medical Center, and our King County Executive Dial Constantine. So with that, I'll turn it over to Dr. Duchin for the initial update.
Thank you, Patty. Thank you for joining us this afternoon. Today, Public Health Seattle and King County is announcing 3 new presumptive positive cases of novel coronavirus COVID-19, including 1 person who died. And I want to just start by expressing our deep and sincere condolences to the family members and loved ones of the person who died. 2 of the confirmed cases are associated with Life Care Nursing Facility. It's a long-term care facility in Kirkland, Washington. 1 is a healthcare worker from Life Care. She's a woman in her 40s. She's in satisfactory condition at Overlake Hospital, and she has no known travel outside of the U.S. The second case is a woman in her 70s, a resident at Life Care, the long-term care facility, and is in serious condition at Evergreen Hospital. In addition, we're aware of a number of individuals associated with the long-term care facility who are reportedly ill with respiratory symptoms or pneumonia, and we're in the process of investigating this situation as an outbreak. We're in the beginning stages of our investigation, and new details and information will emerge over the next days and weeks, and we'll keep you updated. The person who died was a patient at Evergreen Hospital who had underlying health conditions. It was a male in his 50s. He was not a resident of the long-term care facility. We are now in the process of working with the long-term care facility with the support of the Centers for Disease Control and Prevention. Our CDC colleagues are coming out. We have a team arriving tonight. We'll have additional help on the ground from the CDC tomorrow. And we're in the process of providing support to that facility to care for the infected patients, to protect the uninfected patients, and to provide infection control guidance for their staff. At this point, I'm going to stop and turn the podium over to Dr. Kathy Lofi, who is our State Health Officer. Actually, before I do that, Kathy, let me just remind people a couple of things. First of all, novel coronavirus infection, as has been recognized, is spreading globally. And we are having increasing cases in the United States, and we expect to see increasing cases locally. It's very important for everyone to remember that 80% of the cases are mild. Patients frequently don't even need to seek health care. You can think of it as a bad influenza-like infection. However, as these recent cases demonstrate, it can be severe. And we want people to understand that there are things that they can do to protect themselves from getting this infection, just as we can do things to protect ourselves from getting influenza. Hand washing. More hand washing, less face touching. Staying away from others who are ill. Please don't go to work or school if you yourself are ill. We can think about what might happen if we see more cases, which would mean possibly telecommuting. Businesses having fewer people coming into work, either because they're sick or they're trying to minimize face-to-face interactions. Social distancing that we will recommend so that people put more space between them and others so they're not likely to get sneezed or coughed upon. So there may be times when we would ask people to avoid going to large gatherings, to avoid congregating in public settings like sporting events, social events, and so on. But at this point, we do not have widespread community-wide transmission locally. We have transmission that's associated with an outbreak at this long-term care facility. So we're going to be watching the situation very closely, and we're going to be providing guidance as we learn more. At this point, I would say everyone should take the basic precautions: hand washing, more hand washing, less face touching, social distancing, not going to work or school when you're sick, staying home when you're ill, thinking ahead as to what might happen if people in your family become ill, how you'll care for them, if children are dismissed from school, who can watch them, if you've got people in your home who are older or vulnerable, how you'll take care of them, if we have social distancing and people are requested not to go out frequently. Have medications in your home so you don't have to go out and refill a prescription if you don't need to. Have some foods that you like to eat handy so you don't have to go to the store if you don't have to go out and be interacting with other people and touching other surfaces. And finally, it's really important to know that as with seasonal influenza, the people who are at greatest risk for novel coronavirus infection with serious outcomes are elderly, so we will say, as we do with influenza, over 60, over 65, and who have underlying health conditions, chronic cardiac disease, lung disease, diabetes, and the other conditions that we're concerned about with influenza. Pregnant women, perhaps, people have weakened immune systems. These people in these groups really need to pay attention to the guidance about hand washing, not being around ill people, and trying to minimize social interactions at this time to the greatest extent possible. So with that, I'm going to introduce our State Health Officer, Dr. Kathy Lofi.
Great. Well, thank you, Dr. Duchin, and good afternoon, everyone. My name is Dr. Kathy Lofi. I am the State Health Officer at the Washington State Department of Health. I want to begin by echoing the sentiments from those who have spoken before me. We send all our deepest condolences to the family of the person who died. We also want to extend our support to the healthcare workers who are caring for impacted people at this healthcare facility where COVID-19 has been confirmed. I'm going to now echo, I think, some of the comments that Jeff made. The COVID-19 situation is rapidly evolving on a global scale. And in Washington, we are starting to see some spread of this virus. Therefore, we do feel that the risk to the general public is increasing. But as Dr. Duchin said, we do not feel that the risk that transmission is occurring on a widespread basis by any means. Therefore, this means that it's more important than ever for people to practice good health habits, such as washing your hands and staying home from work and school when you're sick. Should we start to see more spread in Washington, we might consider some measures, such as canceling large public events, but don't really feel like that is the situation we're in now. Now that we can test for COVID-19 at our state public health laboratory in Shoreline, we're able to get the test results back much faster, and this will allow us to identify cases and offer key guidance to impacted communities in a more timely fashion. And in closing, I also just want to reiterate that it's important for people to remember that most people with COVID-19 do have mild illness. A smaller proportion will have severe illness, and that is why we are working extremely hard to try to decrease the spread of this virus in Washington. And with that, I will turn it over to Dr. Frank Rito.
Hello, Dr. Francis Rito. I'm the Medical Director of Infection Control and Prevention at Evergreen Health. Evergreen Health is a public hospital district that serves Northeast King County, South Snohomish County. We're a community-based hospital. With the updated guidelines for testing, we initiated testing in 2 individuals who we felt had high risk based on symptoms alone. There was no epidemiologic link to travel, and both of those individuals tested positive. That initiated a cascade of events. And at this point, really close cooperation with Seattle-King County Health Department, with the State Department of Health, with the Centers for Disease Control, and with our Northwest Healthcare Response Network. We are continuing to care for the individual who has survived. We have expressed our condolences to the families of the individual who has passed away. We have additional individuals that are being tested, and in conjunction with the State Health Department and the State Lab, we should have additional information later today. I want to thank everybody who has participated in our effort, and it's been a big shift. We'll take questions later, and I think I'm going to introduce almost promoted you, Mr. Dow Constantine. Thank you.
Thank you, Doctor. I want to begin by, on behalf of the county, expressing our condolences to the family of the patient who passed away, and our thanks to the healthcare workers who are helping keep our community safe. With the rapid developments late yesterday, I was in Washington, D.C. for a presentation that I was making at the National Association of County Officials. I canceled that and got the first flight back this morning because we are rapidly shifting our operations here to be focused solely on, or primarily on, dealing with this crisis. And of course, public health is taking the lead on making sure that the community has the right information and that we are doing all the carrying out all the best practices community-wide, but we also have to focus on our King County operations and the some 19,000 employees who provide a huge range of services and infrastructure across this county on a daily basis. I want to commend the professionals in public health for their around-the-clock work in recent weeks and for their work as we prepare for the long days ahead. The community relies on these dedicated public servants, including our partners at the state, and I want to thank them as well. Counts on them to rise to the challenge of a public health crisis, and they have done so, and they continue to do so. And you've heard how we are responding to the emergence of the COVID-19 virus in our community. Now, in addition, we've activated the King County Emergency Operations Center to support public health, as well as to help coordinate the work of cities across King County. The primary role of the Emergency Operations Center is to provide regional coordination in support of county and local operations, to collect and process and to disseminate situational awareness, and to coordinate resource management for King County and our regional partners. The EOC is currently activated at the enhanced level, meaning we have King County Emergency Management staff on site at our facility in Renton. The EOC will also be staffing a liaison with Public Health's Health and Medical Area Command, which is in this building, and many of you have had a chance to see that operation over the course of the last few weeks. And it will help ensure tight coordination between all the players. I have directed my department directors to move swiftly with preparations for county operations, and I want to talk about how a few of our major departments are responding. Metro Transit established an incident management team to develop policy recommendations, specific operational strategies, and protocols for sustaining Metro operations in all contingencies. Metro will look to public health for guidance on any potential operational changes. Currently, if there are reports of unsanitary conditions in any of our buses, Metro will immediately pull that bus from operation and sanitize the bus before it returns to the streets. Metro cleans and vacuums each vehicle every day and routinely cleans interior surfaces, and that obviously will continue. To echo what we've been hearing from public health experts, we need to emphasize personal health preparedness and riders not traveling when they're sick and covering coughs and sneezes and washing hands. Now, in terms of our homeless response, King County, the City of Seattle, and Public Health's Health Care for the Homeless Network have scheduled 4 trainings so far to review and answer questions about best practices. Trainings are going to be provided in Kent, in Seattle, in Shoreline, and in Issaquah. And shelter providers have been notified of these trainings, and they are strongly encouraged to send staff. The Department of Community and Human Services and Public Health's Environmental Health Division will implement a monitoring schedule to ensure compliance with our guidelines. King County and Seattle Homeless Program staff are updating and confirming addresses and contact information for every shelter, day center, encampment, transitional housing facility, and permanent supportive housing program to ensure the swift sharing of information. And finally, King County's Department of Community and Human Services and Public Health are working with the county's Facilities Management Division, and the directors of each of those agencies are here with us today. And the Facilities Division oversees all county properties. We are exploring options for people who are homeless to rest and recover from COVID-19 away from others in shelter situations. So we want to continue to monitor this situation, and we will return with updates as needed. Thank you, and now I will reintroduce the Director of Public Health Seattle and King County, Patty Hayes.
Thank you so much, Dale. Before we move to questions, I just want to reiterate a couple of things. You've heard a lot of the details of this emerging outbreak this afternoon. I want to share with you my gratitude to the extraordinary professional staff we have here at Public Health Seattle King County and the incredibly hard work that they are engaged in, as Dale said, on a 24/7 basis. Our team of frontline investigators, medical science staff, emergency response, nurses in communication. We're a strong, committed bunch of folks, and we're here for the community. And we've been eternally grateful for the partnership with facilities and the quick response that we had with Evergreen and Overlake and the facility. It's by working together and keeping together that we do the best for our community. Work like this is going on across the country in every local public health department. I've been in touch with a number of my colleagues from the large cities, and people who are doing this work are working to make sure that as we move forward with the spread of this virus, that we are taking the right and good steps for our community. I so appreciate our elected leaders, the scientists at CDC and our state health department for their strong support of this work. Everything is local, as we know, and the support from our other parts of the public health system is essential. We need to make sure that we're based in science and the public health practice. At times like these, we need people at the highest level of government who are committed to truth and science accuracy. The situation, I know, for lots of folks feels very scary. And it's a natural thing to be worried about this, and that's why we're continuing to put information out and to be as transparent as possible as we move forward in what we learn about the virus so that we can shift strategies as it's needed. We are a strong community here in King County. We will stay united and informed. If we do that, we can get through this together. With that, I'm going to open it up for questions, and Dr. Duchin will be helping facilitate that.
Thanks, Patty.
Last year in Kirkland said that their associates and residents were diagnosed with COVID while receiving care in local hospitals. Does that mean you think that the transmission occurred in local hospitals?
Yeah, thank you for your question. No, our colleagues at Evergreen, I really want to give a lot of credit to Frank and all of our healthcare provider colleagues who are working to screen patients for the symptoms of this disease and to contact us when they suspect they might have cases. But these patients were identified after they were admitted for respiratory disease at Evergreen. We don't have any evidence that they acquired it at Evergreen, and our investigation into this outbreak is in its very earliest stages. It's just happened, but we don't have any reason at this point to think Evergreen is where these cases acquired their infection. I don't know, Frank, if you want to comment any more about that? Okay.
When you began, you said there were 3 cases total. The press release spelled out 4.
Yes.
Can you clarify, please?
Yes, the press release was including the case we announced last night, which you may be aware of, a woman who had traveled to South Korea, who's also at home doing very well, did not need hospital care or health care of any type, self-managed, and is recovering.
Can you talk about prediction for the dance bottle of Colo TV? In California, was the very first case of person-to-person transmission. That was transfer there. Any of these cases show potentially person-to-person transmission?
Well, none of these cases traveled. So our assumption is all of these cases were acquired from a person. So yes, these are cases of they acquired them from another person. That's pretty much how the disease spreads from person to person. I think maybe what you're referring to is community-acquired transmission. Yeah. We believe that these are cases of community-acquired transmission acquired here in King County. And what that says to us is as we test more, we'll likely find more cases of this disease because most of them are mild and aren't seeking health care, or if they seek health care, aren't having a severe illness that qualified for testing based on the previous testing criteria and the current testing criteria. So our assumption is that when we see severe cases in a community, there are other less severe cases as well, but we don't have any data to support that at this time. And as we test more, we'll probably identify more cases, and that's why we're really starting to emphasize the importance of these community mitigation measures, which are social distancing measures that are steps that everyone can take to reduce their risk of becoming infected, because we expect this infection will increase over time. And so we know we can't stop it. It's here, and it's going to be here with us in the U.S. for quite a while, but we can reduce our risk, and our focus is on reducing both the risk to individuals of getting sick, but also the risk to our community.
If they ever ask about me, tell them I was more than just a great setup.
Nicole Reloaded.